is my intradermal Osce. So first thing I want to do is get consent from my patient and just explain the procedure. So I want to say that what we want to do is just put a tiny needle just under the skin of your arm, and we'll administer a medication that's going to provide a bit of anaesthetic or numbing around the area of the site for cannulation, and hopefully this should just help reduce sort of the stress and anxiety around the procedure. Also want to ask the patient if they have any allergies, especially to anaesthetics. Just go through my contraindicators of that. Now I want to make sure I have all my equipment. So I have my alcohol swab, a 3ml syringe, a drawing up needle, my lignocaine, and a 27 gauge. You could use a 25 gauge for intradermal, but I've chosen 27, and my sharps container. Also wearing my PPE, my gloves, and my goggles. So first things first, Tash, I'm going to get you to drug check this for me. I'm just going to read it to myself, and if you just want to read that back to me, please.
Lignocaine, 50 milligrams in 5ml, expires June 20.
Awesome. Thank you. So now I'm going to get my syringe, push all the air out, and my drawing up needle. Trying to keep everything in their packages just to make sure that they are sterile. So sharps out. And I want to draw out 1.5 ml because it is an adult. If it's a child, you go anywhere between 0.2 to 1 ml. There we go. Sharps back out. Put that on there. Nice. I just want to make sure that there's no bubbles in this. There we go. And now I'm going to swap my needle around for a 27 gauge needle. Put this on here. Just make sure that there's liquid in the needle there. Perfect. And back in there. Now I just want to identify the site, so where I'm going to be going in is parallel to the vein here, so I just need to clean this. So I'm going to get my alcohol swab, and I'm going to clean the site in a circular motion from the inside out, making sure not to go back over that area and rub bacteria back into it. I'll also just put a swab on my glove, and I'll just wait for that to dry so I know when the site is dry. And I'm just going to reassure the patient that all they're going to do is feel a sharp scratch, and once that's done they should be able to start feeling a bit of numbing. So now my glove's dry, I know the site must be nearly dry, so sharps out. I'm going to go in at an angle of less than 15 degrees if possible, right parallel to the site. I'm going to go sharp scratch, there we go, and now I'm going to slowly insert the medication. What I'm looking for at the time is I'll be looking for a white bleed to be cohering under the skin. Once it gets to about 4 to 5 millimeters of diameter, I will stop inserting the drug. Alright, so I've inserted 1 ml of medication there, and we can see the bleb. Just going to pull that out, sharps out into the container. Now because of this, I've just got to note down the document what drug I've given. So I've given 1 ml of lignocaine at 2 p.m. intradermally, and obviously just need to make sure that I have the correct patient as well. Now that I've done this, I just also want to check for any sort of allergic reactions just in case anything appears. And then after 1 minute to 2 minutes, the IV site is free to cannulate, and I'll just continue to reassure the patient.